Yeah.
If I can do it, then you can too. Oh, team together and we'll make it through. I've been going solo for all too long, and it's time to move on. ADHDers, 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 ADHDers.
Wow. Hello, everyone. Welcome back to ADHD Explorers. I'm your host, Addie, and we got my co-host, Ben,
Hello.
here. And today we have the fabulous Oniazi. She is a lifestyle blogger, a mom to two, a traveler, and a physician's assistant. Is that right, Oni?
Yes,
Tell us
physician
a bit about
assistant.
yourself.
Yeah, okay. Well, so I'm Oni Ozzy. Hey, everybody. I have been a content creator for over a decade now. Started off
Wow.
as a mommy blogger when my kids were very, very tiny, just like born. And I've actually been practicing medicine as a psychiatric physician assistant for years. And my
Wow.
story is a bit complicated because, of course, I practiced medicine as a PA. But I didn't discover that I had ADHD until after I had been practicing medicine and realized that I was checking more boxes than I thought, I should be. And so it's been a wild ride since then of initially some confusion, shame, and then acceptance and just like pride, essentially, because it's something that I want to pass on to my children to have pride about themselves no matter their diagnosis. So, yeah.
That's so nice to hear. I think that a lot of people who get late diagnosed also like I know that I went through that wall of shame. Or like
Yeah.
well, I was like crying of happiness. I was like, oh, everything makes sense now.
Yeah.
Did you feel like
Yeah.
something like that?
I actually did. It felt like a weight was lifted off my shoulders. It felt like I finally knew where I belonged. It felt like everyone that had loved me, despite of not understanding what was going on, I just appreciated them even more because I felt that I was lost and now I'm finding myself. And so it was like the beginning of a whole new journey. So I did have a lot of that at first, but then also because I was late diagnosed, I was already a mom. And so I was dealing with a lot of mom guilt on top of the guilt of having, a late diagnosis of ADHD. So really, to be honest, my own child's neurodiversity led me to also realize that there was something that I need to investigate about myself.
Wow. So how long's it been now since you've known?
Oh, in 2020, so 3 years.
Okay. Yeah.
Yeah.
Oh, wow.
I think there were quite a few.
Were you able to get like a kickstart into the diagnosis process just because you're already in the medical field?
Oh, of course. I did. And you would think that it would have helped in like managing it, but not at all because I've actually gone through almost every medication. I mean, there's probably some forms of the medication that I have not tried, definitely, but I've gone through so many and have still not found something that works well for me. Like, I've personally struggled with so many different side effects that I'm like, oh, no, I'd rather just go without. Part of me is like, okay, I've been managing without, but at the same time, it's such a struggle. So I have to incorporate a lot of things outside of medication, which is ironic. So,
Yeah, that is such
yeah.
a journey, like trying all these different things. And I know for
Yeah.
me, like it was like all those stimulant ones that were very like made me throw wobblies. Like I would get really
Yes.
emotional. And
Yes.
so yeah, finding
Yes.
what works for you is such a journey, isn't it?
Yes. It's such a journey. And it was like a struggle, like, working with my colleague on like, okay, I feel like I was the worst patient, honestly, because it's like after trying and, increasing and decreasing and trying all these different things, I'm like, no, can we try something else? Constantly asking for something else because I'm fully aware of what's out there. So it's like I ended up being the worst patient, I feel like. And after I think it was like a year and a half of trying medication, I was like, okay, let me just chill for now. Let me chill for now.
Yeah.
Yeah.
But I guess at least having that inside knowledge, you're able to advocate for yourself more. Whereas
Yeah.
I think a lot of people like don't know how to advocate for themselves against medical professionals, right? They're just
Yeah.
like, oh, they told me this, it must be true.
Exactly, and it makes me feel like I'm grateful that I have this knowledge and access, but then it makes me feel terrible because I know the struggle, especially here in the US. You can have like so much stigma with,
Mm,
seeking diagnosis on its
mm-hmm,
own, let alone the treatment of it. It's like impossible in some ways. It's a struggle to find providers that'll even, give you the stimulant that you need out of I understand both sides, essentially. I understand both sides. So it's a struggle for all.
mm. Do you think, like having worked in the medical field for a little while, have you seen a change in in like the awareness of things like ADHD and
Oh yeah.
autism in the community?
Oh my goodness. I mean, yes, I'm really just shocked when I'm speaking for myself and at the same time seeing the awareness come when I was, becoming aware of my ADHD and the ADHD in my entire family and the autism in my family, like seeing the world become more fully aware because it was something, especially autism, that I had no idea about growing up because, at least
Mm,
culturally, everyone kept children that were, not easily, manageable in public away and out of
mm-hmm,
sight. And so I didn't
mm-hmm,
know how to navigate that world. And especially as, a mom of a child who's newly diagnosed, whether it's ADHD or autism, I'm like, there is no, handbook, but there's also no example for me to follow
Yeah.
at the time. So it was
mm,
just
Steep learning
figuring it
curve.
out.
So
Yes,
steep.
very steep.
Even like I've autistic spectrum ADHD or DHD as we call it, and
Mm-hmm.
the journey of understanding my freaking brain was it's so
mm-hmm.
long and so
Yeah.
hard. You
Still
have to
continuous.
like
Yes.
yeah, I'm still working on it, even though I learned like
Yes.
3 years ago now. So the fact that you're a parent on top of it and a nurse, it's huge respect. Like, so how I'm really curious now, like how that journey has been for you on your journey of like managing your ADHD while also like thriving in your own way. How have you helped those like align?
So I love that I kind of got to a point in college where I no longer cared what anybody else thought about me. And sorry, I have a cough drop in my mouth since I have a cough.
Oh, it's okay.
But I came to a point where I stopped caring what people thought about me, and I don't know if it was like PDA or whatnot. I was just like, you know what? I don't care. And so I'm going to do what makes me happy, what makes me comfortable. And I really leaned into that. And so, having the diagnosis and then also having these children with the diagnoses, I wanted to be an example of them. So it's like, hey, I'm going to accept myself in all of my intricacies so that they will know how to love and accept themselves. And so it's
Mm,
been, I will say, for me, a little bit easier than some because I've heard so many stories from close friends, family, followers who struggle with a diagnosis and feel that kind of guilt and shame and just a moment, I'm gonna drink some water. Thank you. But they struggle with the guilt and shame and trying to figure out where to go next, but also how will their future look because they've struggled with this all their life and they're like, do I blame where I am in life now because of it? Can I get to where I want to go? How do I manage, motherhood? Because motherhood has a lot of moving parts to it without the
mm,
diagnosis. And then when you struggle to just follow through, when you struggle to figure out the next step and someone is counting on you, like deeply, like life wise, it becomes even more daunting, I feel. And so
mm-hmm,
to be able to like take that deep breath and know that your best is good enough is important, but it's
mm,
not as widespread or accepted because we are just, especially online, a community of we love things to look aesthetically pleasing, but behind my laptop is a hot mess, I may create these videos with, no, seriously. I may create these videos and these pictures that our house looks amazing, but literally I have to count on my cleaners to come every week to help me even just jumpstart the cleaning process. I need an
mm,
assistant to help me just take my laundry and put it where it needs to be after it's clean, because I struggle with starting so many different things. It's like if I don't find pleasure in something or it's not new, I already know and understand it. It's hard for
Oh,
me to
yeah.
start. And in a way, it's like if it was just me, I could deal with it. But because I'm in a home with other people that need to, create a structure, I try my best, but I've been able to accept where I can just kind of hold my hand up and say, I can't do it. And I'm not ashamed to ask someone or hire someone to help me, because I'm, grateful enough, I'm
Mm,
grateful that I'm able to afford the help, in these areas that I have
yeah.
struggled for a lifetime, a lifetime. So,
Yeah.
It's a
And
great
is your
point.
husband neurotypical, or is he also
no,
on
not at all.
no.
No, he's got it all.
Neurospicy.
Yes, very
We
neurospicy.
attract
So,
each other. It makes sense.
No, honestly, because it's
that's,
like, oh, how did that happen? How did we like
yeah.
we both had no idea. We got together and it just, now that we both know late for everything, we both know it's become a whole new journey. And I feel like initially, or at least during that like 7 year slump, it made a huge struggle in our marriage. Like we were at wit's
Mm,
end. But because we both learned to love each other with, with what was going on, we learned to accept the person for who they are and to
mm,
continue to learn them, because it's like we're both like learning who we are over time. So we're not the same person that we got with, and that's
hmm
okay, because people will learn and grow and stretch and, become different people over time and life experiences. And so we really can lean on each other now. We can really like,
mm,
hey, I'm struggling here. I need support there. We know not to take offense in certain things, because or you better understand that person and what their personal struggles are. So, it can definitely hurt a relationship. Like just a moment.
both suffering from rejection sensitivity. That's been something in my
Oh yeah.
relationship where you like set each other off by accident and then you're both like,
Yes, exactly.
The hormones
We
are flowing.
even we even sought out a counselor that was familiar with neurodiverse couples specifically, and that
oh,
she
yeah,
actually
yeah.
helped the best for us. We were just like,
Yeah,
we need someone who gets it. And
Mm.
yeah.
that,
And
that
what are
journey
some
of,
ways you mentioned like 7 year slump, and there's also kind of like I don't know, like the 3 year boredom of like ADHD relationships where you're like, oh, I've known you and now I know everything about you and I'm bored and I want the
Mm,
next thing. Um, how have you guys moved past that, and how do you continue to keep things like
mm.
interesting so that you don't
I
get bored
think,
of your relationships?
fortunately for me, because of my ADHD, I don't get bored. I'm constantly looking for new things and trying to do new things and trying to convince him into new things. And for him, he's
Mm,
like the type of guy that he wants things to just be the same and to just be predictable. And I'm the opposite. And he's like, we've learned to kind of to allow each other to bend instead of break. Because before it would be
mm,
like a hard stop no, once I would say something like that. And so, me, it's like, wait, you're bursting my bubble, and no, I've got to fly. But now he knows, okay, let me be flexible. Like he's the string to my balloon, and he knows that if he's like allowing me to kind of float, that I'll come back down. I'll come back down to
oh,
reason. Just flow with me a little bit initially. And so, and then for me, I better understand why I'm doing that, why I constantly am looking for something new and exciting and having all these or at least for me, are great ideas. But then, then I take a little bit more time before I say it to him. Because I just, whatever's in my head just comes out immediately. It's like, okay, let me
foot
take
in
some
mouth.
time. Yeah, I take a little more time. I think about it a little bit. I process a little bit more. Or at least when he responds, because he's not responding so harsh as before, I'm able to kind of like, okay, think about what he would really want. And is this really going to work overall? Is this realistic? And then come back to reason. So
Mm.
we've learned in this year and a half span since everything was, like that, to really work with each other.
Oh, I love that metaphor of like he's my string because you
Yeah.
you know you still get to go off and float around and like do your thing, but then being grounded for people who like us who are very like like we kind of need that grounding sometimes.
Yeah. Yeah,
I
definitely.
love how you said, I gotta fly. I
Yeah.
just love
Yeah.
the way you said it too, because you meant it. And I was like, wow,
Mhm.
I respect.
Yeah.
Like, that's how I want to feel when I wake up in the morning. Hey, baby,
Yeah.
I
Gotta
gotta fly.
fly.
We will never be caged.
Yes,
Never.
yes. Yes, that's
Yeah,
why we
I guess
work
that takes
perfectly.
us pretty naturally into flying and traveling. So
Mhm.
yeah, tell us about that experience. Like you've traveled with your two young kids, right?
Yes.
How?
Wow. I felt like because that was not an example I knew beforehand. It was really just I felt like I wanted to see the world and I didn't want to stop because I had
Hmm.
children. I wanted them to
Yeah.
experience the world in a way I hadn't. So I was just adamant about let's go. If kids live there, we can make it work. We can bring them along. So it was honestly wonderful. Um, What's funny is that I've learned that I want to travel often, and my partner may not want to travel as much as I do. And that's okay. So that's why I often may go on a solo trip, a girls trip. We do still travel together and have the same amount of fun, but it's like it took us really accepting each other to be like, okay, I may not travel as much with him or the kids together as, in my brain I may have wanted to initially. So I'm still
Mm.
traveling with them, and we have a huge, like, almost month-long trip coming up in a few weeks with the whole family. So that's going to be wild because we've never been gone that
Mm.
long together. So I feel like it's a new dynamic as my kids have grown into themselves, especially with their ADHD and their autism.
Hmm.
And I feel like it's going to be a new way to navigate things because they're picky eaters. They're picky
And it's one
eaters.
thing when you have
Yeah.
like a little baby that you can just
Yeah.
like strap to you and carry
Exactly.
around. But now,
Exactly.
how old are they? Like,
Yeah, they are 6 and 7, and so they
oh
are
yeah,
they
running
need their
around.
own
Every-
space, their own, yeah, constant. They're constantly going, and so I'm excited to like continue the life of traveling with them. Like we have so many
Mm.
plans. We plan on even taking like a sabbatical 6 months to a year where we just travel the world together. And so we're planning like laying the foundation for that now so that we can do that in about 5 years once they hit like middle school age. So yeah, got a lot of
Mm.
travel plans.
It's almost
Wow.
like I love in a few things you've said. You talked about like acceptance of your partner, acceptance of yourself, acceptance of your own children. And I feel like what you're doing is like you're almost leading them to the edge of their like comfort zone and being like, hey, it's quite nice over here. And I think that
Mhm.
as a kind of intention to have, like expanding this area of comfort in all those
Mhm.
ways, that must be really helpful, especially like in a different country. You've got so many different things going on, new languages, new foods,
Yeah.
particularly.
Yeah.
How do you think they'll react to such a different influence?
So the way that we've been raising them, they are excited actually for the new things. They acclimate so easily to changes and new things, which is not, typical for some or for some kids that may have neurodiversity. So I'm grateful for what I've exposed them to. Like every time we're about to travel to another country, I have them work on that language beforehand. So
Mm.
if we go to, where did we go? But my son was learning Portuguese, but right now he's learning Igbo since we're going to Nigeria.
Oh
And so he's been
Mm.
wow!
working on that. And then every time, so they get more comfortable with the language. It's just the food. They're they're particular. They're so particular. So I have to literally pack their comfort safe foods, like a whole suitcase
Oh,
of it, anytime we
Yeah.
travel. But
that's so
they
sweet.
gradually learn and we'll go ahead and eat other things, but you really just want to have that safe food just in case because it's like sometimes you don't want to fight. You don't want
Yeah.
to fight
Yeah.
sometimes. So
Yeah.
Sometimes it's like that comforting, that external comforting really helps. Like even when I take my
mhm.
wife, she's from the US, and when I take
Mm,
her around, she doesn't feel calm sometimes unless she can get a McDonald's because it
yeah.
reminds her of home. So,
I
and all it
can
takes
see.
is a little cheeseburger, and she's fine. She's like, "Oh, the world's good again."
Yep, yep.
So that's nice. You pack little goodies to them. Oh, that's really nice.
Yes.
Oh wow. So I wanna know a bit more about like how you kind of learned to manage your own passions at the same
Mm.
time. Like, do you have a system for managing like your content
Hmm.
creation?
Oh gosh. I think I
Or is it a
mentioned before
beautiful
that.
mess, as we say?
Is it what?
Is it a beautiful mess, as we like to
It's a
say?
oh, it's absolutely a beautiful mess. One thing that I often say to people is I don't like to make plans or goals. I just vibe and go where like God takes me. And
Yeah.
so because when I hyper focus then I'm like, "Oh, this is what I need to accomplish," and I just go all in
Yeah,
and head
yeah.
down and achieve. It's like I've loved that about me because I've been able to achieve so much in my lifetime. So I'm like, why do I got to start, putting a label or a goal on things now? I'm just going to decide and then go and then wherever things shift because, getting into PA school was so hard, but I decided it and it happened. Becoming a content creator, that was by happenstance. My husband saw that I was getting into postpartum depression and suggested, hey, why don't you get back into blogging? You were doing that when we were first engaged, and I saw that it gave you just some happiness and peace. So I went into blogging just to therapeutically like share my struggles as a mom. And because through the journey I saw that, oh, people make this a job and people are doing it for work. Okay, let me try that out. And so I just hyper focused and it's like, oh, we are now like 12 years later and it's like my career. So it's crazy. It's crazy. I just kind of go where life takes me, the beautiful mess, essentially.
So I love that because when you're doing your passions, right? I'm also in that kind of mindset where I don't like to make plans,
Mm.
And so how do you communicate with that with friends? Like, sorry, I'm just hyper focusing on my passions right now, but or
Oh,
do you just say it casually? Like, I
you know
never know how to say
what?
it.
I
Yeah.
literally this morning was thinking about I'm grateful for the friends that I have, like since college, because they knew me before I achieved so much and they loved me despite my mess. Like I didn't know what was going on with me. I was just like figuring life out. I was always angry, yelling, just like I was always dysregulated constantly. But they saw past that. These girls saw past that, past whatever trauma that was causing it, whatever drama I was bringing, and they told me about myself. They loved me through the hard times and just like hugged me physically and spiritually, whether I was close or away, because I traveled for so many different things. I moved to different sides of the country for different things, and through all of that, they have been a constant. I actually just posted like a video that we had a girls trip, and I'm like, I'm so grateful for this friendship. So I'm
Aw.
saying that all to say I never had to say anything. They didn't know necessarily what I was going through, but I've never had to explain myself. And over time, they've
Yeah,
learned me.
that's so
Over time,
important.
they've seen, yeah. And so it's like, I think it is helpful if you know that, okay, I struggle with ADHD. Because oftentimes when I meet someone new, especially if they're working for me, I tell them up front, I'm not organized. I have severe ADHD, and I just need you to know that up front because I'm going to rely on you for this, or I need you to just remind me of that, things like that. But they, without understanding what I was going through, they were there for me and with me. But anyone new to me, especially if they're close enough to me that, something may kind of interfere, I let them know straight up, hey, I've got ADHD. And so
That's awesome.
expect this, or.
Yeah, to communicate it up front. It's like
Yeah,
it's such a badass move, and it's good. It's
yeah,
cool that you have the confidence to say that. Like, that's the way.
yeah,
Um,
yeah.
I like to ask a lot of our guests sometimes, like, and you kind of shared a little bit about this, about your journey with I'm not sure what you called the school, but was it med school you went through, or
So,
what was it called
PA
again?
school for
PA
PA
school.
schools, yeah, psychiatric, or sorry, not psychiatric, physician assistant. Now physician associate. We've changed the name.
So I
Mm.
like to ask people like, what's something hard that you've gone through that you've conquered?
Oh man. So one of those things I keep mentioning that, oh, I went for it even though it was so hard, getting into my sorority.
Mm.
In college, I was like, I had no affiliation, like legacy wise, didn't have like a close friend in it. I just set my mind on it and achieved it. And it was like, a hard thing to get to and through. Um, Becoming a PA is so difficult to get into a program, but also you have to like have work experience with a PA and all kinds of stuff. And I was like so focused and I made it happen. Becoming a psychiatric PA, that's barely even heard of. Usually those jobs even go to NPs, but I decided that's what I wanted to do. And I was like, okay, I'm going to hyper focus and do it. And I honestly negotiated my way into it. Like I created the job. There was no job. I created the job for myself.
Nice.
So it was like, and so I'm just, yeah. Yeah.
You created the job. Oh, I love that. I do think that
Yeah.
the creativity that is seen in so many ADHDers is actually like something that can never be underestimated. Like the fact that,
Oh,
like,
yeah.
the normal way is like taught to us through generations. This is how we do it. Follow the way, and then
Yeah.
you get these ADHDers who are like sending videos directly to employers and being like,
Yeah.
"Hello,
Oh,
there.
yeah.
How to work with-" Is that what you did? Something like that?
Exactly. Oh, exactly. Because
Breaking the
in my
rules, and I
mind,
love it.
yeah,
Sorry.
in my mind, there's always a solution to every problem. So it's like, if you want this, there's a way. Just figure it out.
Mm.
So, oh yeah, there's,
What
you gotta get creative.
what was it about that kind of work that you were so passionate about pursuing it?
So as just PA in general, it definitely was my ADHD before I knew it because I was trying to figure out what schooling do I want to go to? Do I apply to pharmacy school, become a physician? And then I came up randomly during my research online what a physician assistant was. And I saw that you could literally work in any specialty that you want to. You don't have to specialize. And I was like, I never want to do the same thing forever. This is for me. I can change whenever, And so I've literally, as a PA, I've worked in orthopedic surgery, pediatric emergency medicine, urgent care, pain medicine, and now psychiatry has been the longest. And I plan on staying with it. Like, I could probably do it forever. Like, I found my niche. But the reason I became a PA is because I never wanted to just niche down and just do one thing forever. So,
Do you
yeah.
feel like
How is a
you're
PA different to, like, say, a nurse or a doctor? Like, where do you fit in
So,
the medical world?
if we're going to make it like a simple reference, it's like in between where we see patients like a doctor and we prescribe medication like a doctor,
Mm.
but we're not allowed to have our own like practice, or we have to have our name sign along, or not name, but a doctor has to co-sign anything really big or important, like a stimulant. A doctor would have to co-sign it. Any other medication that's not like in that class, it's whatever. So really, physician assistants were created, I believe, in 1960s by the medical board, and so it's under a doctor's orders. And I don't know if you've heard of an NP or a nurse practitioner. It's the same thing. PA and a nurse practitioner. It's just nurse practitioner was created under the nursing board, so they just operate separately but are the same thing, the same role.
Okay.
Do you
Okay.
feel
Yeah, that
like
makes sense.
being involved in psychiatry has helped you understand your mind?
Oh, absolutely. It's the reason why I truly understood what was going on with me. It took me, I mean, several years of practicing to finally figure it out, but it's helped a lot in understanding who I was, where I was going, and then also for my children, and to really know that there was hope. Even if medication is not necessarily working for me now, I knew that there is hope with ADHD. There is a way, to manage it outside of medication. But really, I'm just grateful that I was, I guess, destined to practice psychiatry, because I don't know if I ever would have figured it out, or at least not at that time, without it going into that area.
being in
Yeah.
that world.
Yeah. Yeah.
I do feel like a lot of ADHDers, when they first get diagnosed, it is a bit overwhelming sometimes because you want to know, like, okay, what practically do I do right now to move forward?
Yeah.
But like, no one has ever showed us that, and there's no like, well, we make guides, but like, there's no like practical guides being like, okay, how about, okay, we learn to regulate the nervous system, we learn to like
Yeah.
see if meds work for us, you know, we try all these things, and so I really I understand that struggle.
Yeah.
Yeah,
Yeah,
someone
definitely.
actually, one of our community members was asking about like how do you manage your ADHD without medication? They said I don't want to become dependent on it. I think if it's working for you, like being quote
Oh, yeah.
dependent on it isn't necessarily the worst thing.
Yeah.
Like,
Yeah. No, I totally understand because I often have patients say that out of fear, they don't want to try the medication because they don't want to become dependent. But I feel like if you already have that mindset, it's less likely that that's even going to happen. As long as you're using it in a way that it's prescribed and being intentional about it, taking breaks,
mm,
really dependency, I don't think would be, or even abuse would be what we would be worried about. But consistent long-term use can cause, for someone to need a higher dose to get the same effectiveness over time. So that's
hmm
something you could work with a provider with. But I don't think that people should be afraid of trying it because you can always stop it. But if you have the intention of seeking something else, seeking a certain feeling, abusing in any other way, then yeah, especially if you have a history or are prone to anything like that, then it might be an alternative that you want to look for.
Yeah, like it's cool that so you're pretty familiar, I guess, with all the different kind of meds, which is
Hmm.
quite an informed opinion, which is quite nice to have on the show. I think Addie's like dropped out; her internet's a bit dodgy, so I'll just
Yeah.
continue from here. Um, so I really, you were talking about, um, and I feel like this is an important topic to talk about, and let me know if you don't want to talk about it. But I feel like when we first get diagnosed, there's so much cultural guilt and shame, one,
Hmm.
and then there's guilt and shame we have of our own lives and all the ways that like history has like, you know, maybe we failed, we didn't bring in homework, or we didn't feel like we could focus on homework, and then we were ashamed for that.
Yeah.
How is there? Do you have any way that you manage these kind of emotions to digest them?
Hmm. I let myself feel them for a brief moment. I don't let myself feel those type of emotions for too long. Um, so being intentional about, okay, I can feel this way, but I can't stay in it because that's when I am going to be stopped in my tracks. And
Yeah,
I can't, either get out of bed or I can't do that next step or even take care of me, because I'm focused on that feeling and wallowing in it. So I feel for me, I allow myself to feel guilty, like, oh, but then I push really hard past it, no matter what may be going on, because sometimes you affect other people when you do that, when you do have those feelings.
for sure.
Um, and it's unfortunate, but for you to be able to continue to live life, because unfortunately, it's not going to be the last time. It's like,
yeah, yeah,
so it's like, do we stop everything because of this, emotion it's gonna happen. It's gonna happen. But for me, it's important to give myself grace because I know it
wow,
wasn't intentional.
it
I
sounds like
know I'm trying my hardest and I know I get frustrated with myself, but then I know that it's gonna be a brighter day, a brighter moment. And lucky for me, with my ADHD, my attention span is short, so I've already forgotten that I did that.
Lean
Like,
into that. Lean into
yeah,
that.
I
it's like
lean. I
you
lean heavy
push
in
off.
it.
I see that you pushing off with a strong leg of love, self-love,
Yeah.
self-care,
Oh
because
yeah.
you were like, oh, like that's such
Yeah.
a loving tone, and I was like, oh, that's so nice how she talks to herself, and I think
Yes,
that's so
yes.
important.
Yeah.
Just because I do see a lot of our community get triggered into freeze in their nervous system
Mhm.
from
Mhm.
experiencing guilt and shame. I know it's something that we have a big issue in our community, and I think that talking about how to manage that is a really important thing because because I do think we can get stuck in it like an emotional trance, and sometimes it's like
Yes.
days long, and you're like, well, I've been like lying on the floor for a while,
Yeah.
and
Yeah.
so it's almost like out of self-love, you're saying to yourself, hey, like, let's feel this for a bit, and then we're gonna move on.
Yes,
And
yes,
I
exactly. Like I'll even look at the clock and give myself some time, like, okay, you have till 11:30 to still feel this way or zone out or, scroll for sorry,
yeah,
doom scroll for
yeah.
like 30 more minutes and then it's the next step.
Wow, that's cool that you give yourself a time limit. Well, like
Yes.
you give yourself the time to just,
Yeah.
okay, I'm gonna feel this for this time.
Yeah.
Wow, I love that. Good work. Good work.
Oh, thank you.
So, Addy, do you want to share some questions from the community?
Yeah, let's get into it. So kind of related to your medical field stuff. Someone was asking, can you talk about the relationship between drug use slash addiction in people with ADHD? Is that something that you have much knowledge in or have seen much?
So I won't say that I have like a big familiarity outside of screening for it. Um, because a lot of things people may use for negative, well, I like to phrase it as negative coping skills because I feel like we
Mm,
always need something to cope, but trying to be very intentional about it being positive. Although it may not seem like positive for some people, for me, scrolling social media is my coping skill. Um, some people may eat. Some people are just essentially looking for that feeling to escape, So I escape into
hmm
social media. Um, but really, when you are using a stimulant to escape, um, you're likely going to use more than was intended to get
mm,
that feeling. And
hmm
so it comes down to if you have that personality that can be whether it be addictive or it's hard for you to let go of a certain feeling or a certain desire, craving, then it's important to steer clear of any kind of controlled medication. It's not as easy as just saying it. That's why it's important to have treatment plan and have a
mm,
provider that you can work with. But I don't think that the general public should be afraid of stimulants so that, in case that they become addicted, you have to really be seeking that feeling, that escape for that to be the cause. And so if you think that that's a possibility, you definitely want to start with therapy first and work your way around because there are definitely non-controlled options that can be used, but then also mindfulness and intentionality to try to manage the symptoms away from using a stimulant.
mm. Do you think
Those,
people that are inclined towards like substance use issues, alcoholism, things like that, do you,
Mhm.
do you think there is benefit to them p- with being on medication as a way, as something that's like, because they're probably self-medicating a lot of the time, right?
Yes, that is true. That is true. It's a sticky situation and a slippery slope when it comes to that because I see what you mean and I've seen that. But the danger of giving them the stimulant oftentimes when you have the license is greater than
Mm,
giving them the stimulant to see and hope that it will help long term, which is not always the case. It could just be another gateway to things. So really, with any patient that I have, if it comes to possible stimulant, I always screen and try non-stimulant options. And if it's like something like addiction, we manage that first. That's priority before
mhm,
treating the ADHD. So oftentimes when it comes to practicing psychiatry, you want to see what's the priority to treat first and then go in that order. So if we see something's well controlled, depending on the patient, maybe a stimulant might be the option down the road, but we really have to be careful, and there has to be a lot of work done first.
mm. How often do you see the overlap of people who are struggling with addiction uh,
And
in
and
ADHD
have a
patients?
I won't say it's too often. It definitely I would say less than a fifth, if that, of my
Okay.
ADHD patients. Yeah, it's not necessarily a huge amount that, but granted, we have to think about the population because it has to be a population that is able to afford treatment. So
Yeah, yeah, that's
whether they
true.
have
And the people who are
insurance,
not
yeah.
going to the doctor are probably more
Yeah,
likely to be.
yeah, yeah. So it's like, do they have insurance or are they able to afford the treatment anyway? So I'm just thinking about that overall. And then again, like if someone started at a younger age, were they, are they thinking about going seeking a provider for help with this, or does it happen over time? And so it's just like you really have to think about the actual demographics. So yeah, that's
Yeah.
something to think about. Yeah.
hmm Um, some other things that people have been asking about. So, you talked a little bit about managing your ADHD without medication. So
hmm
what are your main techniques? You said like mindfulness.
Yes. So definitely my self-love because
Yeah.
really a lot of how you allow yourself to feel to push away from the RSD, to push away from ruminating of negative thoughts, is going to be important to allow you to create an environment where you can start. Because starting things or even finishing the last 5% of things is what I often struggle with and what I see a lot of people struggle with. So, allowing, creating the best environment for a healthy mindset is going to be important, whether it's therapy or whatnot. Because I'll say that a lot of this self love also came through therapy.
Mm,
So I have definitely over time become more, in this position to accept myself because of therapy. So therapy, mindfulness, um, I hire help for things that,
mm,
initially I would have been ashamed about, but now it's like, okay, no, I send my laundry out because otherwise it would not get done. I have someone help me put it away or it's going to stay in that corner forever. I
mhm,
have cleaners come um, because it's just so hard to maintain the clean house. Although my kids are now a little bit older, so they are going to be doing their own job of cleaning up as much as possible. But really, so that I can, even though I may be disorganized, I thrive in order, essentially,
yeah.
when things are a little bit
We
more.
hate it and we love it at the same time.
Yeah, yeah. So it's like, okay, I've got to try my best. So I'm even still teaching myself, okay, always be doing something. In my head, that's what I tell myself, like, always be doing something, always be putting things away, always be, reorganizing things. It feels like it's never ending and it's never going to finish, but try to keep doing it, even if you don't finish that task, because finishing a task from beginning to end is difficult, but giving yourself grace, even though you only moved the needle halfway, at least it got moved. So yeah, essentially that's it for me. And then allowing my
Mm,
hyper focus to be very because everyone is different when it comes to their hyper focuses. For me, um, I like achieving things, and so those things are like what I'm hyper focused on. But for some, they might hyper focus on like, building a puzzle or, drawing, the best picture. But lucky for me, it's trying to achieve things that, I feel like someone's told me that I couldn't achieve. And so I keep going at it. And I think that was partly from my upbringing culturally, because my parents, I'm first generation Nigerian American, and so our parents were really strict on us to do the best and achieve. And sometimes in my head, I convince myself I do that in spite of them. Like, oh, they want me to be a doctor. I'm going to be a PA instead. Just like trying to
mhm,
push what I think is against the grain, but it's really making myself happy to get to those
Right.
things at the end of it. And so I know over time, like I've reflected and saw, oh, I never even congratulated myself for making all that happen because I was just like, okay, next goal, next goal, next, not even a goal, like next thing, next thing, next thing. But really it's okay because you're achieving either way. So just like being being like, okay, you're doing a good job. You got this. You're getting there. Keep going. I think it's motivating, self-motivating.
mhm, mhm. Um, do you have any kind of like a routine at all, or do you just go with the flow a lot of the time?
Great question.
Um, Definitely, I will say 15%, 50% go with the flow. the other 50% is routine. That's helpful by being a parent because it forces me to wake up and get kids ready early. So because of that, I get up. Oh, another thing is I work out.
Mm-hmm.
Excuse me. If I don't work out, the rest of the day is not as productive as it could have been, I feel.
Mm-hmm.
It helps me kind of wake up and get into that mindset to go get it, go get things done. Although, I might get things halfway, 75% of the way done. I at least started. So the routine is definitely easier when I know there's crunch time because I definitely get things done because I know there's pressure, that time pressure of, okay, I got to get to this because I have to pick up the kids by 2:30. I got to get to that because, I have this time that I have to do that. So really, that's why it's 50% mess, which causes me to go hard the other 50% because I now have a short amount of time to get things done.
Yeah. Is your work as a PA like scheduled or is it flexible and you can move it
Yes,
around?
it's flexible as in I create my own hours, but
Mm.
yeah, so I put okay, on a certain day on Fridays, I'll see my patients and I get to like see them during this 5 hour block and just keep going. And so just yeah, I do that every Friday. And so the structure of that is so helpful for me because I know that I'm not
Have
going to
some
do anything
regularity.
else. Yeah, yeah.
Yeah.
You mentioned a little bit ago about creating a good environment for yourself to
Mm-hmm.
focus in, and you talked about, you got the cleaner to make the space tidy, but are there other ways in which you like recommend how to optimize your environment for yourself?
Oh, okay. Water bottles everywhere.
Oh,
Definitely.
nice. Like a visual trigger.
Definitely.
Mhm.
Yes, definitely water bottles everywhere because out of sight, out of mind. Like I think I went through a few years of dehydration because I didn't have water
Mm.
bottles. So, and if I don't see something, it's not gonna get done. So water bottles for me.
That's such a good
Um,
idea.
I'm all about efficiency. And okay, one thing for me, it's hard for me to get out of bed because I don't like the feeling of the cold floor. We don't have carpet. And so I have like
Mm.
house shoes everywhere so that I can have that comfort of the house shoe. And it can, for me, because I feel more comfortable, I'm more motivated to get up and do things instead of like, I want to, get back to the couch because I don't like how it feels on the floor. So really like making things efficient for me is the biggest thing. Like I had,
Yeah.
I have trash cans like everywhere in my bathroom because I want to make sure the trash gets into the trash can. And I know if it's too far, I'm not gonna, it's just gonna pile up and then I'm gonna be like, ew, gross. And so it's like making things as efficient for me so that I can continue to be motivated is so important. Like for my kids, I want to, in the morning before they go to school, have them read lessons or do Spanish or whatnot. So I put in the dining room a little basket with all their books and pencils and things. And even though it
Mm.
just messes up the aesthetics, I need it there so that I can make sure that that gets
Launch
done. And
pads.
so, yeah, so I make everything easy. Like I eat the same thing for breakfast every day unless I feel like doing like I have only two options. The one where my lazy breakfast or my I have energy breakfast. And so like simplifying things I think is the best thing so that I can put my energy and my hyper focus into actual productive things. Like make the choices minimal as possible.
And if making
Yeah, I
them
love that.
paths, I think that's such a smart idea because I think that decision fatigue is so real with ADHD.
Yes.
We
Hmm.
Yes.
get burned out from making any decisions. We don't
Yes.
want to waste our brain juice, so you make the decisions in advance.
Exactly, because you get
I love
distracted
that.
Mm.
otherwise. If I want to eat something new, I'm gonna start going to the store and find something else to do, and then it was like, oh, I was supposed to make breakfast. So yeah, just
And I
keep the
love that you're
choices
like
short.
meeting yourself where you're at. You said you're like, if I don't have trash cans, I'm just gonna make like little piles of trash everywhere.
Yeah.
I'm like, I never put I have a cast iron pan on the stove. I never put it away. Cast irons, you
Mm.
don't really wash them. You like rinse
Yeah.
them and then like, and so it's just always on the stove, right?
Hmm.
Instead of
Yeah.
like that extra step of having to like reach into the cupboard and pick up a
Yeah.
It
pan, I'm
makes
like,
such
well,
a
it's there. I'm
difference.
ready to cook.
I put a
Yeah.
chopping board out
Exactly.
all the time. It just lives on the counter. And when I
Yeah.
wash it, I dry it on the counter where it lives. And
Hmm.
it's changed my life. No
Yeah, and you're
resistance.
like, this might not be the clean aesthetic countertops or tables but like it works for me.
Yeah.
Exactly.
It's about
Exactly.
it is about what works for us at the end of the day. Like when we're
Mm.
managing our own life and making it slipstream like that. I wish I'm gonna
Yes.
make everything like that. No decisions.
Yeah.
Mm.
Yes.
Did you ever go to that
Um,
point no, you wouldn't wear like Mark Zuckerberg doesn't wear any different clothes. He just wears the same clothes every day. That's like taking it to the max. But we're
Yeah,
fashionistas,
exactly.
we've got to have a varied wardrobe.
Yeah, it's harder when I love like I what is it called? Dopamine dressing? I like
Oh
dopamine
yeah.
dressing. Like give me a theme. I'm there for it.
Mm,
I do think that there is something to be said about how you dress, especially when you're like doing your own hours, doing your own work.
Mm,
If I don't
yeah.
dress right for my
Oh,
work time, I am
yeah.
screwed. What is with
Oh,
that?
oh, for
yes.
sure. If I
Exactly.
stay in
Oh,
my
yeah.
pajamas, I'm
Oh,
like, it's a
yeah.
potato day. I am a full potato. Get my beanie that says
Oh, you're
potato,
right.
Why?
put it on my
You're
head,
right.
and then that is me.
Yes,
I don't know
exactly.
why that is the
Exactly.
case. But do you ever like sometimes I forget to dress properly? I'm just wearing a robe and I'm like, wow, why haven't I done anything today? Like at all. Oh no, I
Yeah.
forgot to get dressed. Damn you morning
Same,
routine.
same,
It's
same.
like, what the freak? I know some ADHDs keep their shoes on to like so they feel like they're okay, I'm still doing stuff mode. And
Hmm.
I was like, oh,
Hmm.
I'd like
Yeah,
to try
house
that.
shoes.
Yeah,
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 house slippers.
that's why you have house shoes because they
yeah.
are like, oh, I'm still doing stuff. Also, my what is it? Physio told me I have to wear shoes all the time because of my bad arches or something. I don't know.
Oh.
Wow.
So another question, I guess to kind of round things off is back to parenting. Someone has asked, are there any recommended parenting techniques for mothers with ADHD to support their children's
Mm.
development?
Well, definitely conscious parenting I think is important
Mm,
because what I realize, whether as me being a child or now having my own children, um, you don't want to respond or react from anger. You want to be intentional because just like you, if you have ADHD, it's a high chance your child might have it too. And
mm-hmm,
how they react and respond to things may not, they just got here. They don't necessarily fully understand, or the way their mind works isn't like a fully developed prefrontal cortex. So giving them
mm-hmm,
grace and really being intentional to like create those bonds with them, I think is so important for yourself and for them. Whether it's
mm,
healing you or allowing you to get comfortable to the point where you can tell your kid, okay, I'm a little overstimulated. I need some
mm-hmm.
space. Because
Wow.
there's times like my kids know, okay, mommy needs a moment, leave her alone. And, my son will kind of switch and be like, okay, mommy, why don't you go rest? Why don't you go sit down? If I tell him I
Oh,
just
and
need
then
a
that's
moment, he
teaching
knows, yeah,
them to advocate
yeah.
for themselves as well.
Yes, exactly. They're so good at advocating for themselves. Oh, I'm so sorry. They're so good
Mm-hmm,
at advocating for themselves. I'm just like so grateful to be able to change, how I was raised in a way, which I don't necessarily blame my parents, first generation, and things were done the way they were done then.
yeah, yeah.
But being able to see that, recognize that, and not continue the cycle, I'm just so
Mm-hmm,
grateful to have that opportunity to at least try to build that relationship with my kids and to build that confidence, within them so that they can have that as they grow. Like immediately when I told my son that he had ADHD. Like I didn't hide it from him immediately. So he's like, at first he would like be at school, be like, "Oh, it's because I have ADHD." He would like use it as an excuse, and we're like, "You can't use it as an excuse, but be aware, so that any accommodation that's needed will be
and
gotten.
ask for it. Yeah.
Anything that's a problem, like okay, so with both of my kids, it's like two different approaches because my oldest with ADHD, he does not get medicated, does not need the medication only because he's been thriving in school without it, makes all A's. And so
Mm-hmm,
we're like just watchfully waiting, but still have him get accommodations in school because we knew that, he doesn't always pay attention to his fidgeting, so he can have his fidget toys and things like that.
mm-hmm.
My other son, literally, ADHD medication stimulants changed his life this semester. And I won't say it
Oh,
was our fault. He was like so young that we were not ready to put him on. We felt like we weren't ready and we were scared. I don't know. Actually, I wasn't scared. My husband was scared. But when he got the right medication, it changed his life. It changed our lives.
mm,
He is able to be in a general education classroom sit through and finish his work and learn in ways we couldn't have imagined before. And, it makes us just so grateful that we were so open to talk about things and to figure things out together because, at times parents are hesitant to start their kids on medication. I think the biggest thing I would want your audience to know is like, if your child needs the medication, be open to try. It's not going to change your child. They're not going to be a whole different person, but it can make the world a little bit easier. So I'm grateful for that. And, they've got two different approaches. Like I said, one child doesn't get medication. He has ADHD. The other one, he needed it. And we're just so grateful for it.
Yeah, I
Wow.
think it goes back to it's the same thing you're doing with yourself. You're like meeting them where they're at and
Yeah.
doing what each individual, like everyone in your family is so different. You said, your husband has like the ways he wants to do things, your kids, and you're just like meeting everyone where they're at, and like
Yeah.
there is something to that. It's so beautiful.
Wow. You shared so many golden gems with us through
Oh,
living a life where you're I love that your bravery in terms of facing difficulties in your life. And I think that sometimes, like we ADHDs, we want to hide because we don't want to accept
yeah.
any more on our plate. You've had this bravery to manage your partner, your children, and I really commend you for that. And I think you
Thank
should be
you.
celebrated. I think we should celebrate all our wins. That's like my new I don't know,
Yes.
my new thing on life. Just
Yeah, it's
celebrate.
hard. It's hard. I used to never, but now I'm gonna try.
Yeah, because we're taught like modesty, like, oh, you have to just like,
Mhm.
like, brush it off. And it's like, or
Yeah.
humility, whatever, and it's like, nah,
Yes,
actually,
yes,
I'm
yes.
awesome. I brushed my teeth today.
Exactly. Like I got up and I got ready. That was an accomplishment.
I
Like
did I.
seriously.
Oh, wow. Well, where can people find you and follow your journey?
Everyone can follow my and my family's journey at Sincerely ONYI on all social media platforms.
Awesome. Thanks so much.
Thanks,
And
Oni. It was,
Thank you
yeah, great to have
guys.
you on. You're so lovely.
Oh, thank you.
And yeah, everyone listening, thank you for being here. We love you guys so much. We're just out here trying to build this big community of ADHDers, supporting other ADHDers. And if you need some resources, you can check out ADHDers.com. We've got our workbooks there. We've got Pay What You Can. We've got a Discord community. You can come and chat to peeps. It's real fun. And if this episode has been good for you, share it with some people, leave a review, rate us. We love to hear from you. Thanks so much.
cool.
Bye, bye,
And
bye,
keep
bye.
looking after yourselves. Lots of love. Bye-bye, everyone.
Bye.
Bye.